Welcome to It's Your Case, presented by VetCT.com. I'm Heather, your radiologist on demand for this week. Here we have a 12-year-old mixed breed dog who presented for screening thoracic radiographs. Once you've reviewed the radiographs using your systematic approach, then go ahead and watch the video. I'm going to start by noticing that on the lateral view, there's just a generalized increased opacity in this area here, superimposed on the heart. It's fairly ill-defined, and I can't really place it. When I go to the right lateral view, I see that it's a better defined region of increased opacity centered here. However, having only looked at the lesion from the lateral views, I really can't tell where it's located. It could be anywhere from the body wall to the lungs to the heart or even mediastinum. The orthogonal view is necessary to triangulate findings. In this case, once we go to the VD view, it becomes fairly clear that the lesion we've been looking at has been summating with the lung and is actually located in the body wall. When I look in a little more closely, it's apparent that there's interruption of this rib, the left fourth rib, and that there's an expansile lesion creating a periosteal reaction and bone lysis. This feature is highly consistent with a neoplasm of the rib, especially given patient age. Now, I'd like to show you this line here, which is highly consistent with an extrapleural sign. An extrapleural sign is one of the tools that we can use to determine whether a finding that we see is located within the lung or extrapleural, meaning outside of the lung. To illustrate this more clearly, please welcome my cat. Here you can see that when he's relaxing on my spare bed at my house underneath the quilt, his body creates this gentle curve, and the differentiation between where his body starts and ends is quite gradual and ill-defined. So is the case for the extrapleural sign, where as we trace this line, we see it's a very gentle appearance. Now, for those of you that are wondering what's the difference between an extrapleural sign and a lesion that doesn't have an extrapleural sign, let me show you an example. Pretend that this orange circle is a lung nodule. If the lung nodule happens to be located peripherally in the lung, where it meets the body wall, the differentiation between the body wall and the lung nodule forms a very sharp margin compared to the extrapleural sign, showing us that this lesion is outside of the lung, which creates a very curved margin. For those of you whose cats prefer to sit on top of the bed, this is what it looks like. You can see that the edge of Mac's body and the edge of the bed now create a sharp margin. So, taken together in this case, we can say that there's an increased opacity centered on the rib, that its features are highly consistent with an aggressive lesion, and although we would need sampling to know for sure, this is highly concerning for a primary rib neoplasm, such as chondrosarcoma. Be sure to read the full report on this case. Now, we're off for the Easter long weekend, but we'll see you on Monday for It's Your Case.